Good evening, I'm Max Goldwasser filling in for Lee Anderson. Just moments ago, the Food and Drug Administration approved the Moderna vaccine. That makes it the second weapon in the fight to stop the spread of COVID-19. Meanwhile, Oregon is now expecting a second shipment of the Pfizer vaccine. Alec Nolan explains how the Oregon Health Authority has determined the order of who is receiving the first doses.
With the arrival of the Pfizer vaccine across the state, the Oregon Health Authority has finalized their recommendations on who will be the first to receive the new doses.
OHA has initiated what they're calling Phase 1A of vaccine distribution, as many question how the line will be formed for receiving doses. Phase 1A lists 4 groups across healthcare services that will be considered first in line. Starting with hospitals, urgent care, and memory care, followed by long-term care facilities, first responders, individuals in correctional settings, group homes for children or adults, then high-risk outpatients, in-home care, and lastly, other outpatient and public health workers. Jesse Kennedy of the Oregon Nurses Association says while most frontline workers are ready to get the vaccine, there is concern on having enough to distribute throughout the state.
So I think the majority of nurses are going to be ready to get it. I think the main component right now is whether or not we're going to have enough vaccine to really get everybody who could possibly come in contact with a COVID patient. I think right now it's mostly trying to triage which nurses are going to be in the greatest level of contact with potential COVID patients and getting them taken care of first.
Up to 400,000 Oregonians will be vaccinated in the first round. OHA says their framework for distributing vaccines will be based on equity, individual, environmental, and activity factors. They are also aiming to be equitable in their approach, stating, "These priorities are critical to the diversity of people living in Oregon and to mitigate historical and contemporary injustice and stigma of communities of color, tribal communities, people with disabilities, and long-standing mistrust of the system and distrust of vaccines." OHA's Vaccine Advisory Committee will relay the next phases of distribution beyond 1A to include critical workers, people with underlying health conditions, and those older than 65. But according to OHA, the general population will have to wait. Eligibility for those vaccinations are not expected until spring of 2021. In Bend, Alec Nolan, News Channel 21.